my presentation, I will try during my presentation today, which is not technical, to share with you in the first part the main information concerning ICAN, and in the second part an update of the evolution of IPC in Africa, and part of it maybe was shared by Professor Shaheen Mitar during her presentation, but it was specific to training and education. The African expert team will be here, will be happy and honored to share with you their research and study along the conference. Actually, I'm here with my colleague, Mr. Jacob Nakwan Gupte, who's our honorary secretary. So on behalf of ICAN and other African experts who will be sharing with you their experience, I'll take this opportunity to thank Prof. Aranga and the entire scientific and conference organization team for all their support that facilitate our colleague who supported me for this, Prof. Babakar Ndoy, who's considered one of the doyen of IPC in Africa with Prof. Shaheen Mitar, Prof. Shade, Mrs. Anna, and Mr. Lande Kabego, who's the WHO IPC focal point. So for us, as you can see the map, you can see how big really is Africa, and also you can see even how the world second largest and second most populated continents, of course, after Asia. It's very rich in natural resources, and at the same time is one of the poorest continents of the globe. The health system in Africa is facing many challenges, such as high existing disease burden, a shortage of healthcare workers, lack of financing, weak governance and coordination, and inadequate infrastructure. According to WHO, Africa accounts for 24% of the global. So, as you can see, also Africa, according to WHO, accounts for 24% of the global disease burden. But only 3% of the health worker and less than 1% of the health spending all over the world. The impact of infectious disease on the development really is very huge and important. So despite the important success of vaccination program for all you and others, really are causing high mortality rates in Africa. The impact of infectious disease on African country is no longer a crisis only for the healthcare sector, but also it presents a challenge. It presents a challenge to all the sector. It has the potential to reverse those gains that made in human development in the last few years. For ICAN, Infection Africa Control Network, is the largest IPC organization in Africa. It's registered as non-profit company in South Africa in Cape Town. We started working in 2008. It was launched and also chaired by Prof. Shaheen Mitar in the beginning. We are having last year, I think 2023, about 2,200 members from 34 countries among 55 countries, 5 African regions. For ICAN, our vision is to having a continent where safe patient care is ensured for all through implementation of evidence-based infection prevention and control program. The aim, of course, is to establish and support professional capacity building towards sustainable IPC structure. I talked a bit about the mission in the previous slides. Here you can see the ICAN team. You can see that the ex-chair in the center, Prof. Shaheen and Prof. Sadeh, and other colleagues are either in the head office in Cape Town, they are down on the left, and those on the top, the actual board of director, and on the right, they are the new co-opted member. We are trying to decentralize the activity of ICAN, starting from the head office in Cape Town. Actually, we are having 5 hubs, 5 sub-regional hubs. The first is based in Egypt, in Cairo, Northern Africa hub. The one in the south is based in Zimbabwe. The east is in Ethiopia. The west is in Nigeria, and the center is in Cameroon. We are having also several associated IPC association in Africa that you can see in the map from 17 countries. The latest we have was from Rwanda, and we are having some new working already that we are building newly from some other country. Here you can see the same. I think Prof. Shaheen spoke a bit about the ICAN education and training program that started from the sample training going to the education, and the top program that you have is the international postgraduate education program. Prof. Shaheen also spoke about those. So there are the slides, the flyer of the fundamental course and the IPD course. Here you can see most or the main partner, and one of our main partner and collaborator and founder is US CDC, beside other also partner that you can see in the map, either international or regional like Africa CDC. The challenge that we are facing in ICAN, actually, like any other non-profit company, most of the board of directors, they are volunteer. So one of the main challenges, the limited human and financial resources to meet the needs and demands of member state and regional partner. The real challenge also to ensure adequate management, linked availability, and commitment of the member. As I told you, all we are volunteer without other professional responsibility. The other language or the other challenge is the language barrier. Actually, for me, for example, my mother tongue is Arabic and my cultural language is French. So just I'm trying to use English only for my professional, and it's limited language, as you can maybe observe during my presentation. So the language barrier, for example, among 54 African countries, 27 are French-speaking country, and most of our partner and support all the time is coming with English documentation and support. Also, we are having 3 Portuguese-speaking country and also 4 Arabic-speaking country. So we will need really support and collaboration with all our partner and collaboration to overcome those challenges. So this is the first part of my presentation. And I would like to invite you, to inform and invite you to join us at our international conference in Cape Town that will start with the pre-conference the 30th of June 2025. And the conference will be from the 1st to the 3rd of July 2025. I tried my best to translate it in both language, the Langa and the Hindi. Thank you. I can continue? Thank you. So on the third part, I will try to share with you where are we in Africa with infection prevention and control. So as you know, nowadays, and maybe since 2023, and some of the speakers, they spoke about that, is the launching of WHO Global Strategy, and also the launching of Global Action Plan, the monitoring framework that was developed, and as was shared by Dr. Aoud, I think this morning, that we are working on the guide for the implementation of the Global Action Plan and monitoring framework. So those program from WHO, the Global Action Plan Monitoring Framework on IPC, was developed and will be implemented soon in Africa. So in Africa, like any other low or mid-income country, the recognition of importance of IPC and its central role is evident, despite the significant challenge, achievement by limited and beginning to emerge. So I will try to share with you this presentation those challenges. So the African epidemiological contexts and the impact on patient safety, healthcare-associated infection, AMR, and the IPC. And in Africa, most of the time, when we are talking about IPC, we are linking it or we are joining it to WASH. So many of the colleagues in the healthcare facility, when they are talking about IPC, most of the time they will say WASH and IPC, as the primary step for IPC is establishment of WASH. So epidemic and pandemic-prone disease in Africa pose a serious threat to public health security. So the continent report really dramatic high incidence and mortality rate of disease such as viral hemorrhagic fever, Ebola, Lassa, Marburg, cholera, meningitis, avian influenza, and many other, who are responsible, those disease or high rate of illness and death, have a determinant impact on the economic of member states. So the infectious disease, despite here the impressive reduction in infectious disease burden, have the top 10 causes of poor health or death in Africa are communicable disease. With emerging for healthcare-associated infection, with emerging and re-emerging infections affecting the region, the possibility of healthcare-associated acquired infection being transmitted to patient and healthcare worker, especially nurses, is a critical concern. That's why one of the objectives when we're talking about IPC, we're telling we're looking as a target the safety of patient and the healthcare worker. For AMR, we are facing the challenge of inadequate infrastructure, lack of technical skill, and essential supply for, especially for optimal diagnosis and treat of AMR. This leads to an increase of the infection disease. For IPC, despite infection prevention and control, evidence-based practices to minimize the transmission of healthcare-associated, many healthcare systems in Africa are challenging to implement them. As I said, WASH most of the time is linked to IPC. Really, it's important number of healthcare facility in Africa. They are lacking the basic IPC disponibility, especially the disponibility of water. So water, as you know, is essential for health living. However, in Africa, there is still lack access to safe drinking water and improved sanitation. Also, the emerging pathogen and AMR can spread quickly and cause outbreak in healthcare facility and community. Also, the lack of resources and infrastructure and training staff. So maybe Prof. Shaheen spoke during for the training the impact or the influence of the main first Ebola outbreak 2014-2016 and COVID-19. So in Africa, pre-Ebola, we were lacking IPC program, absence of IPC guideline, lack of formal training, limited IPC activity in few countries. Here we can say maybe Senegal and South Africa. The domain of IPC was annexed to WASH, especially in French-speaking country, or they're calling that hospital hygiene. So absence of a professional trained in IPC. ICAN was one of the first non-profit organization that started IPC in Africa in 2005. During Ebola, awareness of the absence of IPC, great international support has been implemented to urgently improve IPC and WASH. Short-term objective, as you know, when you are facing epidemic and outbreaks, though most of the objectives are short-term objective, in-service IPC training mostly that will not be sustainable, availability of PPE, and building also Ebola treating center. Post-Ebola, things really get improved. IPC concern become common and recognized as recognized are remain but remain unclear. Many of the colleagues, when they start training, talking about IPC, they thought it's just linked to outbreaks and to Ebola. And because most of the objective of those training were linked to, was done within an emergency context with short-term objective just to control and respond to the epidemic. Significant reduction in technical and financial support with the declaration of the end of the epidemic, as it happened even during Ebola and many other outbreaks. By the end of the epidemic, most of the available funds and resources really will be over. IPC was abandoned due to the end of the epidemic. So, as you know, many reported cases in Africa, either in 2014-16 in West Africa, and I was there most of the time, 2014-16, and also in DRC in 2018-19, and I think the day before yesterday, there is new cases, I think, that was diagnosed in Rwanda. So the APC lesson that we took post 2014-16 Ebola outbreak. So like no other event, the 2014 Ebola outbreak has made clear the fragility of the existing health system in Africa. But to conclude that Ebola, the epidemic Ebola has opened a window for IPC in Africa, and most of the IPC practitioner and the non-profit company organization like ICAN really start building from that point. So then it happened, the second event, the pandemic, the COVID-19. So the gap between the end of Ebola in West Africa and COVID-19 was about 3 years to 4 years. But when we started with the COVID-19, really we found ourselves that lack of IPC program, absence of IPC guideline, because most of what was done during Ebola was just short-term objective, limited IPC activity in few countries. The domain remained annexed to WASH, limited number of professionals trained in IPC. During COVID-19, the lessons learned post-Ebola were beneficial to start. That means we were having at least something at the capital where we started with it. IPC concept is known. The technical and financial support was important. After the post-COVID, IPC concept became more common and recognized as important. Significant reduction in technical and financial support with the declaration of the end of the pandemic. The case about so the main IPC lesson post-COVID introduced many challenges to the healthcare facility. The care team need to be strengthened through the pandemic, introduced a stressful work environment that you know all about, and highlight the importance of mental also health and well-being, have shown the devastating consequences of the lack of preparedness and program. Also, it highlights the major gap in WASH service. So COVID-19 pandemic has opened a new window for IPC for Africa. So the 5 part is what's being done for IPC in Africa. So in general, it was achievement that made IPC in Africa at national and healthcare facility are significant, and their impact are recognized. The lessons have been learned from the experience of measure on the important role by IPC program and others. Also, the regional IPC actor, mainly WHO, Afro, UNICEF, ICAN, Africa CDC, have played a key role in the promotion and implementation of IPC program and activity. And my colleague, Dr. Landry from WHO Afro, and Dr. Wanadi, also Wanadi Alimi from Africa Center for Disease Control will be having 2 presentations to share really their experience. WHO Afro was the leader and coordinator during and after the major epidemic. Here, Dr. Landry will be sharing with you the presentation with more details. One of the key elements that was developed during COVID is in collaboration with Africa CDC. It was the policy brief for the legal framework for IPC program. So ICAN played a really key role and really played an important role during most of the epidemic, either Ebola or COVID. It was under the leadership of the former president, Prof. Shahin Metar, and then with Prof. Chedly, and also with all the colleagues from the ICAN board member. We continue many activity, education, training, implementation, outbreak management, research, even it's still a bit limited, planting association and advocacy. So I'm about to close. So the next step, the new challenge faced by our organization and country are many, including take direction from WHO Global Strategy and Global Action Plan and Monitoring Framework, conduct a continent-wide assessment to have reliable data to support planning, maintenance of the achievement in WASH and IPC of the last decade, benefit from lessons learned from other epidemic, align with the latest international development in IPC and the antimicrobial stewardship, develop a regional implementation plan with the aim of harmonizing activity and better coverage. There have a harmonized education and training program that targeted pre and postgraduated curriculum. Actually, WHO developed the pre-service curriculum, and we are working with the team of WHO of HQ for development of pre-graduated curriculum. Promote healthcare-associated surveillance in the continent. To conclude, effective IPC is essential to prevent and control epidemic and reducing preventable healthcare-associated infection, and is an integral part of safe and efficient and high-quality health service delivery. However, failing health system, limited human and material resources, climate changes, armed conflicts, and social instability can really, and still even till now, negatively affect the quality of healthcare delivery in general. This due to care worker qualification and shortage, also supply chain disruption and insecurity. To improve IPC in our continent, Africa, it's necessary to know the political, socio-economic, and epidemic context to understand the specific obstacles and facilitator encountered locally. So thank you very much.
Thank you, Professor Chedly, for summarizing all the activities and the initiatives that are going on in the African region.